lot of people have been missing this, and it's officially time. Med School Lessons with Matthew, Part 3. So today we're going to talk about hereditary spherocytosis. So let's take a look at a patient and what they would look like. So today we have a 4-year-old male with yellow discoloration of his eyes and skin for the past 5 days. So if I hear yellow discoloration, we're talking about jaundice. And jaundice typically occurs from either the GI system or from heme. So I'm thinking either liver, biliary tree kind of area, or a heme problem. So the question is, which one is it? So let's get a little bit more information. So I'm seeing fatigue, shortness of breath, that his father had a splenectomy, I see pallor, and jaundice, and also just a big spleen in this patient. All of those things are screaming out to me that this is a hematological problem. So we would have a bunch of different lab values, but I'm not going to go over those right now because I want to talk more about what exactly it is, rather than how we get to that differential, because I just want you to understand what HS is and how it happens. So you can see these guys here are going to be our spherocytes. They are spherocytes because they lack central pallor, which means that they don't have this little white spot in the center, and they're also just more small and compact, and they're spherical. So what is HS? It's the most common cause of hemolytic anemia, or breaking down red blood cells. So the question is, how does it happen? Well, in hereditary spherocytosis, we have all of these different proteins that make up the red blood cell membrane, and it gives it some fluidity. So a normal red blood cell can move its shape a little bit, so that way when it gets to the microcirculation within the spleen, it can be freely filtered. But the problem is, when we lose any of these proteins, we lose that stability, and then we end up getting a really rock-hard, condensed version of a red blood cell that isn't going to change its shape. And that's what we see here. We can see a regular red blood cell with good membrane integrity until we get down here. It can't be deformed any longer. So it gets trapped within the spleen, and the macrophages will break them down, causing hemolysis. And we'll get a thing called splenic trapping, which means that we're going to get a crap ton of red blood cells stuck in the spleen. So you can imagine that this puts you at risk for hemorrhage, because if you imagine that you have a giant bag of blood just sitting in your abdomen, and something comes along and either punctures it or you get trauma, you are at risk for bleeding out and dying, which is why this condition is typically treated with a splenectomy, so that way it doesn't put people at risk for this any longer. So why are spherocytes going to hemolyze in this disease? Well, the thing is, I think of it sort of like this game. It's a cube that you can't put into the circle hole, for instance. It's something that doesn't change its shape. You can't mold it around and try to put it through like Play-Doh or something. It doesn't change its shape, so it gets stuck. And that's when it's going to get hemolyzed, and then you're going to break down these products. Now, what is going to happen? We need to treat this. So, biggest things that you're going to want to do is minimize the complications of chronic hemolysis and anemia. So you want to check out for the hyperbilirubinemia, which just means that you have really high levels of bilirubin, and splenectomy is one of the main ways to treat it. So that way you can just get it out of the body and your body can try to function normally now. So what's the possible sequela of HS? Basically, what could happen because of it? Gallstones. So when you have a bunch of unconjugated bilirubin, which comes from your hemolyzed red blood cells, it's going to bind with your calcium. And when it does that, you get a thing called pigment gallstones or bilirubinate stones. So those gallstones are going to be chronic, very painful. So it's really advantageous to actually just take out the gallbladder at the same time that you take out the spleen for these patients. So you're going to do a cholecystectomy as well as a splenectomy. And the big thing that you want to take into consideration when you take out the spleen is make sure that your patients are fully vaccinated against encapsulated bacteria, because it's your B lymphocytes that are producing antibodies against those types of encapsulated bacteria, because that's the process that they need to do to be able to fight out those types of infections. So that is HS, and if you have any questions, please comment down below. But until then, I will see you in Med School Lessons with Matthew. See ya.